Welcome, welcome, welcome. This is another episode of Global Voices of Legacy, where we invite global change makers, thought leaders, and icons around the world who are leading impactful legacy, leading lives rooted in gratitude. Today, it's my pleasure to invite and talk to a dear friend of mine, a colleague for a long time, Dr. Martha Gyansa-Lutterodt. Welcome on the show.
Thank you. Thank you very much, Prof.
Can you tell us a small thing about you before we start the actual conversation, where you are speaking from and all that? Very short.
Okay, thank you. My name, like you have rightly pronounced, is Martha Gyansa-Lutterodt, and I am a pharmacist by training, but moved into policy and global work at the latter part of my life. Retired as a public servant, as a director for technical coordination at the Ministry of Health. That's about some 3 years now. And that's me. I do other things after retirement, but
we'll come to that.
Yes.
So where are you now?
I'm in Accra. Located? I'm based in Accra, and
Ghana.
yes,
wonderful.
As it is. Yes.
Wonderful, wonderful. So this interview is actually rooted in gratitude. To me, gratitude has become a calling. So what is gratitude? What does it mean to you? Gratitude, what does it mean to you?
For me, gratitude is accepting to acknowledge the fact that something you really do not deserve, but given. And something that really, not because of your qualities or not because of your qualifications, but just grace located you. Wonderful. And so as you move on in life, you acknowledge that grace, that it is by grace that you are what you are. That's and right. So for me, I am grateful to God for how far He has brought me. Without Him, honestly, I don't know where I would have been. And that is why my gratitude knows no bound. It is limitless. I cannot say that I have done something on my own. It is just by God's grace. So I am grateful to Him.
Wonderful. And of course, grateful to other people that He uses to bless, isn't it?
Exactly.
Wonderful. Can you share with us one or two stories of gratitude that you believe have really impacted the trajectory of your life? One or two of them. I believe there are many.
Yes, they are actually. One story or two I will share will be how I entered into the global space, and as if by design, I was a pharmacist working in the polyclinic in Tema. And then my boss at the time, Dr. Kubaji, had been handling what we call the Tema Health Week. And so I didn't do public health. I just did my pharmacy, and that's it, at any other meetings. And one strange day, the deputy minister walked into our space, and they asked me to do a speech for him. Wow. And that he was going to speak at the meeting. So I drafted a speech and brought it. That deputy minister was Dr. Moses Adibo. Bless me. He read the thing and asked me whether I have done any postgraduate. I said no. Then he told the district director, who was the municipal director at the time, Dr. Kubaji, that, look, this girl will go places, so please let her go back to school.
Wonderful.
But that was the end of it. Then one fine day, I was attending a meeting in GNDP was organizing a meeting on rational use. And so I went to present, and he met me again. I said, I thought by now you should be somewhere. And the rest is history. Wow. And he ensured that the chief pharmacist made provision for me. At that time, I had done some postgraduate work with Leeds University. He said I should go back and do something.
Wow.
And everybody wanted me to go and do hospital management. And I said, no, I didn't want hospital management. I wanted something that is in the health space.
Wonderful.
I don't know what was pushing me, but I know it is God. And so that, I would say, is something I am eternally grateful to Dr. Debo, and eternally grateful to the chief pharmacist then, Mr. Fufi, and eternally grateful to the GNDP who did the sponsorship, Dr. Asiema, and the rest of the team. I am so grateful. The second had to do with a loss in my life. I had my last born. He was 12 at the time, and he somehow got a cancer of the scrotum. And we tried all we could, and we had to go all the way to the UK for treatment. And I was the chief pharmacist then. And it was a difficult situation to be in. I was not available to do the work I should do, but I had to take care of my child also.
Of course.
Because I was away and still working. And at that time, I was also taking a master's program at JIMPA.
Okay.
How I managed that period, I look back and I know it must be God.
It must be God.
I lost my son in 2013.
Sorry.
But I am grateful that I actually got more children, a lot more boys in my house, some of them the age of my son. And, and that experience of taking care of my son linked me to a few other players in the industry, especially when at a point in time there was a resistance to the treatment they were doing for my son. And so I pick all the issues around resistance from there, and then that became my trump card when I had to do this antimicrobial resistance. So you see,
wow,
what God does.
That's right.
Sometimes it's difficult.
That's right.
But what came out of it made me to become a trailblazer for antimicrobial resistance in our country and in our continent.
Look at that.
And I represented the continent as the expert at the UN level.
Wow.
So out of that pain,
that's right.
Look at what God has done.
Something
and I'm
good
grateful.
Came out of it.
Yes.
Wow. Wow.
I am great. It's like Samson who went to kill the lion, then honey turned out from the lion. So you see, out of something bitter, something sweet came out. I am grateful.
This is awesome. I mean, that's when I hear stories like yours, then it shows me that God really brought this program to me. Because without this, how can I even have known about all this, about you, even though I know you so well, So thank you so much for sharing this with me and with our audience. God is so wonderful. He's really wonderful.
Yes.
So how has gratitude impacted your life?
And so I realized that, look, in life, God places things in our way for a reason.
Right.
And that is why I see myself that I am in that space because somebody also needed to be blessed.
That's right.
I needed to be the door opener for somebody else to enter and move to their next level. And so that has not been lost on me, even as was in public service. And I have consistently ensured that I build capacity behind me and before me and around me in a manner that if I need the work done, the people understand what I wanted and they will do it right. And I left the Ministry of Health, antimicrobial resistance programs are going on. I left the Ministry of Health. I was doing a lot of work on health technology assessment. That is going on. I left the ministry doing so many other governance things. And I believe sincerely that these are never dying. And for me, it is something we should be grateful for.
Wonderful, wonderful,
Yeah.
wonderful, wonderful.
Yes.
So now we come to purpose. What drives and sustains you and why?
What drives me? I think my basic principle in life is that my life must give God glory.
Wonderful.
My attitude must give God glory.
That's true.
Whatever I do, I must be in the story of somebody who will say that, but for Martha,
That's right.
I would not have been here.
That's right.
And so for me, if there are several others doing the things I used to do and they continue to excel in them, and I am grateful to God for several of them who are doing mighty and big things. Some have gone to the university to become lecturers, they are professors, and they are doing big things. And for me, that is the whole purpose of man, that we live and let us live and ensure that others become beneficiaries of the grace that God has given to us.
Wonderful. Wonderful. So what are you hoping to achieve? Or what problems are you currently solving or have solved previously? Tell us some of them.
Oh, I could. I remember very well, one of the things that I saw at the time was the role of pharmacy or pharmaceutical issues in regulation will be. And so during the time of the treaty, I was really very versatile with the West African Health Organization, who was also working around having a program or policy that can help the West African states to do what they have to do.
That's right.
I say that program led to the development of a lot of documents working with Sybil, Dr. Sybil Osei Ajimayebua. And we drafted a lot of things. And when African Union saw what West Africa was doing, I was drafted as the lead. I was the lead for the policy and legal for West Africa.
Wonderful.
So when they saw that and they had their meeting, I was asked to lead that section and guide them. And as God have it, we had to be one of the earlier countries to ratify the treaty for the. So we contributed to the model law itself, the African Union model law. We contributed as a region, we contributed as a country. In addition to that, then the ratification process. I must say that I virtually led that in Ghana.
That's
and ensure that because the ratification process is a huge one. It is not within your domain alone. You need Parliament to approve of it.
Exactly.
You need the executive to approve of it. You need to get a letter from the president to say that Parliament has approved of this, because as a country, you are ratifying a process by the African Union bylaws.
Wonderful. That's wonderful.
So we had to do that, and I led that and ensured that Ghana became, I think, the fourth or the fifth country to ratify the treaty. And at the time, we wanted to host. I was in full gear for us to host the AMA in Ghana. And I think at that time, the trade had already come to Ghana, and we were advised that other countries needed to benefit. So we let it go, and at that time, Rwanda became our friends as a country, as so they got it. But we were not dismayed, and before I left the ministry, we started pushing for the idea that Ghana must lead the management of the AMA in Rwanda, and the rest is history. Ghana, led by Dr. Mrs. Belize Mimidako is
That's right.
now the inaugural Director General for
Wonderful work
the
done.
AME. And so it is something that I look back and I realize that it is important to think beyond the now.
That's right.
And think 4 or 5 years from now, what
That's right.
should the ground rules be like, especially for so many things that we are doing.
That's
And
right.
I'm happy that we were able to do this and got it out of the way.
Wonderful. Honestly, I'm so happy I'm talking to you because all these things would have been kept to yourself. But you are doing so much outside of yourself, which needs the world needs to know, and acknowledge, because it's not, these are not small achievements, especially coming from a lady. Not
Thank you.
Exactly. So I'm
Thank
really
you very
glad
much.
I'm talking to you. So now we move on to impact. So from gratitude, we've gone to purpose. Now we come to impact. How is your work influencing others and communities locally, globally? Tell us.
Oh, I, I believe that we have tried to do our best. Like I kept saying, when I'm doing something, I just want to do it and do it well.
That's right.
I do it not because of what I will get out of it.
That's
I
right.
do it because I see it as I see my work as doing it to God.
That's right.
That it is God who has assigned me that purpose.
That's true.
And I would say that for a long time, we go to Well Health Assembly and then we try to figure out what we should be saying. But at a point in time, I just felt that we need to get our acts together.
That's right.
And so we put teams together and to ensure that teams from not from the ministry alone, from other
That's
people
right.
who are doing big things like the
That's right.
CHAC institutions,
That's right.
like the medical and dental,
All
because
the stakeholders. That's right.
role, yes. So we bring them all together and then we take note of the discussion points at the assembly.
That's right.
And then we try to get statements for each one of the discussion points so that we will not go there and we don't have anything to say.
That's
And
right.
whatever we are saying will be rooted in the data that we have as a country.
Wonderful.
And so that system we built has stayed and they are using it, and I'm happy they do it. And so Ghana will go to the assembly and we all have, in fact, the time we started it was during the COVID time where we have to have the virtual assembly. And it was amazing. We have to assign people to do the reading or to speak to the issue on behalf of us. So much so that everybody has a folder that even if that somebody is not available, somebody can do that.
That's great.
So I believe that that's a system we have built and it is lasting, and they are still using it to today to ensure that Ghana's contributions at the assembly are solid. Ghana's contribution at the assembly is rooted in the data that we have.
Wonderful.
Then again, I will talk about antimicrobial resistance.
Wonderful.
Something
Baby.
a lot of pain, yes. And I believe that after all said and done, when my son passed out, I decided that, look, I need to take these things further. Because pharmacy should not just be about the data, about supply chain and all that. It goes beyond that. And so I took the AMR thing seriously and began to speak. Even at the assembly, I speak on the issues, what Ghana is doing, and we try to put some data together. And indeed, our policy and plan became one of the best in the country at the time. And became what I call showcase for others, like a piece that others would like to look at and work around it, because we were one of the first countries to include environment within the AMR stakeholder arrangement. And I believe that a lot has gone on. Now we are talking about the global agenda for the second action plan, global action plan. And a few of the things that we have discovered did not work well, like the governance and coordination, are things that are being taken on board and being worked on. I also believe that another area of work has to do with health technology assessment, which hitherto we only think about clinical evaluation as the basis for selecting medicines. But as a developing country, as a LMIS, that is a low and middle income country.
That's right.
It is important that we look at the economic areas of the work before we do the selection. And so with the major stakeholder of doing the selection of medicines, I began to think outside the box that, look, we cannot continue to say that clinical evaluation is enough for selection of medicines. And so we gradually included the economic evaluation principle. And now it has become the norm, and they are using it to ensure that medicine selected in the country for the health insurance scheme are based on just not the clinic, but also economic. And not only that, because I believe sincerely that health technology assessment is a policy tool. It can be used for so many things, not only selection of medicines. Of course, selection of the medicines is, call it the low-hanging fruits. But I believe that we need to look at our health systems and prioritize. Now we are talking about Mahama Care, or call it a focus on non-communicable diseases. It is important that we look at what is economically viable and where can we get value for money, especially for the treatments we are offering. Of course, for non-communicable diseases, you and I know that it is cheaper to prevent.
Of course.
To allow the disease to take place.
Exactly.
And so that is where the primary health care and all the issues that go with it comes to play. And of course, we also know that some of the old medicines could still be useful in the of non-communicable diseases. But you know that as health professionals, we want to be modern. We want to be part of what call it globally everybody is using. But you see, our countries are not at the same level. So we can compare ourselves to the US, to the UK, and what they do. We have to start somewhere if we want to reach a larger population of our people to ensure that they have the necessary care, the basic care that is required. So I am very happy that now the HTA is finding its way within the health sector priority setting mechanisms. And for me, if we are able to get that right, there will be a lot of savings in how we prioritize what should be done today or what should be done tomorrow. That is all the priority setting agenda is. You don't have money, but you want to take care of the people. So what is the best way forward? It is not putting all together to do, but we can do them in stages to ensure that we get value for money for what we do.
Exactly. But that is even part of rational use. Medicines that are not only effective, but affordable to the nation, to the community, and to the individual and the family. So if older drugs are working, why go for the newer ones if people cannot afford it? It doesn't really make sense. So I think we are on the right track, with your ideas which you are putting forward instead of keeping it to yourself. Wonderful. So apart from the policy area, what else have you been doing with yourself?
That ties into the same part of
legacy building.
Exactly. Like I said before, I retired as a public servant, but I'm not retired.
Exactly.
So I make myself useful with the Ghana College of Pharmacists as well.
Wonderful.
As the head of public pharmacy, as well as the head of the division.
Wonderful.
I also, until November this year, I was the chapter chair for Ghana for the West Africa Postgraduate College of Pharmacists.
Wonderful.
Currently, I am the deputy chair for the West Africa Postgraduate College of Pharmacists for the Joint Faculty Board.
Okay.
That is one of the highest decision-making bodies regarding academic work within the college. And so my concentration had been on there, but I also support African Union, NEPAD, as well as the African Union CDC. I support African Union CDC on their antimicrobial work because of my previous experience with as an expert with the UN expert committee. And the last document they came out with, which was discussed at the UN 2024, I think, the Living No Voices, Africa Voices needed to be heard. And we put together that document, and it was well received. In fact, compared to the previous political declaration, African Union, for the first time, attended this meeting with a document in hand.
Wow.
Before then, we were not having that document. So I believe that we are making impact as Africa, especially with the antimicrobial space. I also support the African Union NEPAD, which had gradually handed over to African Medicines Agency.
That's right.
As the committee chair for medicines and policy reforms, policy and legal reforms. And I chair that as well. And we have helped in reviewing the model law to include substandard and falsified medicine, SF. And a committee has just been formed regarding that particular piece of work. And I'm grateful I chaired that one during the inaugural meeting, but they have a chair for that as well. And so I believe sincerely that we must not only build a legacy in our country, we must build it, like Kwame Nkrumah once said, the independence of Ghana is
meaningless.
Not as important. It's meaningless if it is not reflecting in the whole of Africa.
Exactly.
And so I believe that whatever we are doing in Ghana must be impacting Africa, and Africa must impact the world.
That's right.
It is important that we all take that route. And that is why of late I get worried that we don't have young people in global health, because sometimes you look at the gap between what we have done and the next group of people who should be following us, but some way, somehow they are not available to do that. I get worried, and I have been engaging the early career pharmacists that they should consider not only local champions, champions, they should go beyond the
shores of Ghana. That's right.
Exactly, and do something in the global space, because how can we get the next Mimidakus? How can we get the next others unless they are in that space doing what they are supposed to do?
That is true.
For me, my current drive is to how to get young people interested in the things that we used to be interested in.
That's right.
And what we have built now, and how they should take the necessary steps to ensure that these are built on and this taken to the next level.
Wonderful. Amazing. Amazing. You've talked about legacy already, but just to concretize it, what legacy are you intentionally building?
What legacy? For me, I think that being visionary is one legacy that we as a people must build, wherever you are. You must be visionary. You must think beyond the now. If at the time I was GNDP program manager or as the chief pharmacist, I did not go beyond pharmacy, I'm sure I don't know where we would have been. But I believe that I also built on what others have done.
That's right.
And what others like Mr. Fofie, Mr. Yelu, Mr. Che, and others, they have built on, and I went ahead to ensure that we look beyond the now, we look 5, 10 years beyond the now, and ensure that we do that. The second one I would say will be compassion. Leadership without compassion is a misdemeanor. That is to say that you must be compassionate enough to know that people have limits to what they could do. And you must be compassionate enough to lead in such a way that people would like to follow. And so compassionate leadership is what I want to see myself living behind. And I believe that I have tried my very best to ensure that that leadership is built on compassion. And that compassion means that sometimes you may not even have yourself, but you try to support others so that they can do what they want to do. I can cite one example. There was at the time one young man in our church. There are a few of them, a lot of them, but I will just cite one of them. He passed the WASI, which is the university entrance examination, but only to realize that he cannot enter the university at the time. I was like, what is going on? I didn't even think about what I have in my account. I just wrote a check for him that, look, go and pay your fees and enter the university. He did. He finished, got a first class.
Wonderful. Look at that.
He got a first class. Yes, he got a first class. And now he's doing his master's outside.
Wonderful.
He just came to marry last week.
Wonderful.
I had to go to where the marriage is, somewhere in Kumasi, to be there. Just to see what God has done. So leadership without compassion does not really work too well. So I believe that compassion is very key in doing the things we do.
That's right.
I have seen myself as a trailblazer, blazing the trail, ensuring that pharmacists can still be useful in health.
Of course.
Not just because we will be in the hospital alone. Hospital work is very important, but we must also be in the policy space.
That's right.
Speaking to the issues, speaking to governance, looking at global work, looking at national work, looking at the regional work, and ensuring that they are all coming together.
That's right.
And that is why I look back on AMR and I'm happy I blazed that trail. I look back on health technology assessment. I was glad I blazed the trail. And so there are a few things that we could do and leave legacies for ourselves. Being visionary, being compassionate, and being trailblazers. Yours may be different, but mine, for me, these are the 3 areas.
Wonderful. This is absolutely amazing. Amazing. So,
thank you.
When people hear your name, Dr. Martha Gyansa-Lutterodt, what are 3 words that you want to be associated with you and why?
Oh, okay. I said a few of them earlier. I will say that they will remember Martha Gyansa-Lutterodt as that visionary leader. That set the pace for things to happen. And that ensures that he doesn't look at your face when he gives assignments. He just asks you to give me a pager. And that pager would set so many things in motion.
That's right.
I saw myself as a very compassionate person. I go beyond the ordinary, even if you are my staff. If I realize your output is not going well, I go beyond you to find out what are the issues, whether it is home or it's I do that. And most often I get it always right. That when the home front is not good, you will not get a good output in the office.
Exactly.
And a lot of them can testify to that. And again, when they remember Martha Gyansa-Lutterodt, they will remember Martha as a trailblazer, leading and guiding and establishing frontiers that had never been considered pharmaceutical. And I recall also with pride that for the first time, a pharmacist was made a technical coordination director.
Exactly.
That is to say that you are looking after medical and dental, looking after nursing and midwifery, looking after health promotion, all the technical areas within the ministry.
In the health, exactly.
It is
not just medicine.
Thank you very much.
Wonderful. So the 3 words: trailblazer, visionary, compassionate, isn't it?
Thank you.
Wonderful. Wonderful. So that will capture this thing. So how can people contact you?
Well, my name, like I said, Martha Gyansa-Lutterodt. I'm on LinkedIn as Martha Gyansa-Lutterodt as a global governance expert. I'm on Facebook as Martha Gyansa-Lutterodt. I'm on X Spaces as Maglut1. MAGLUTT1.
Okay.
And so that those are, and also, of course, I'm on Instagram as Martha.Gyansa-Lutterodt.
Wonderful.
And so that's me. You can reach out to me, and my email is maglut at hotmail.com.
Wonderful. Wonderful. So before we let you go, what one parting piece of advice will you give to our audience, especially the younger generation?
Thank you very much for this opportunity. I believe that every young person listening to me or hearing me or watching me must know that you have a destiny, and that destiny is in God's hands. It's not in your hand.
That's right.
But you can do things to make it work out for you. First, you must be grateful.
That's right.
No matter your estate in life, no matter where you are in life, just be grateful. Be humble to learn from others. Be humble to be mentored. It doesn't really matter. You can sometimes I believe that you must grow even above your mentor, but don't show attitude when you are being mentored, because really it does not really help. People may not give out their best to you if they see that you have an attitude.
That's right.
And secondly, there's no end to learning. Build your own capacity. I have to go to school. Apart from my first master's that was paid for, the rest of my masters I have done, the rest of my education and fellowships I paid for myself. And so invest in yourself, build your own capacity, be grateful for where life has placed you, and ensure that you as you grow, as you move forward in life, don't forget those who paved the way for you. Don't forget that. It shows you are ungrateful if you cannot remember those who held your hand to be where you are. Acknowledge them and ensure that you are not lost in terms of gratitude to them. And for me, if you do this, you will go far in life.
Wonderful.
Thank you very much.
Amazing, 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 amazing. Viewers, thank you for being here. It has been really my pleasure to talk to our first lady interviewee on this show. That is Dr. Martha Gyansa-Lutterodt, a very close friend of mine, a colleague that we've worked for a long time when I was in WHO and she was the director of GPU.
GNDP.
Ghana National Drugs Program. That's how far we trace our roots. And she, as she's told you, she's going to do so much more beyond Ghana. So it is really my pleasure to have talked to you. You have opened the way for other ladies to come on the show. And what a wonderful legacy you are building already. Thank you so much for being here. And thank you for you listening, wherever you may be tuning in from. It has been my pleasure to bring you this version of Global Voices of Legacy on the Global Grafters Global Communications channel, where we bring to you transformational interviews from global change makers and thought leaders from around the world to tell us the legacy building lives they are leading, serving their communities and beyond, to enable people watching, especially the young ones, to also start building their lives of legacy. Thank you, and continue to share, continue to subscribe, continue to join the community conversation as we move this wonderful program forward. Thank you.